Hello, my name is Puneet Belani, and I'm a neuroradiologist in the Department of Diagnostic, Molecular, and Interventional Radiology at the Mount Sinai Hospital in New York City. Today I'll be providing a very brief overview of Chapter 12, Physiologic Evaluation of the Brain with Magnetic Resonance Imaging in the 8th edition of this text. There are no disclosures or conflicts of interest. MR imaging of the brain has advanced significantly in terms of quality, technique, and available advanced imaging sequences. In this chapter, we review conventional and advanced MR imaging techniques as they pertain to diagnostic and treatment planning, with descriptions tailored to provide an appropriate understanding for the neurosurgeon. These are some of the topics we'll be discussing very briefly in this PowerPoint and in much more detail in the text version. Routine brain MR sequences include T1 pre- and post-gadolinium, T2, FLAIR, GRE susceptibility-weighted imaging, diffusion-weighted imaging, and its ADC correlate map. Optional sequences include volumetric SPGR and MPRH sequences for surgical navigation, Fiesta or CIS sequence for imaging of the internal auditory canals and the inner ears, as well as other sequences to be discussed subsequently. Diffusion-weighted imaging can provide information on a variety of pathologies. It is important to remember that not everything that is bright on diffusion is an infarct. It is important to check the ADC map to make sure that there is true diffusion restriction manifest by ADC hypointensities. A variety of pathologies can restrict on diffusion, such as infarction, hemorrhage, infection, and neoplasm, as well as artifacts. Functional and DTI imaging can provide data regarding eloquent brain parenchyma and tracts as related to treatment planning. For example, in this figure, you could see that the central sulcus is clearly anterior to the parietal AVM in this patient, which would be useful information in terms of surgical planning. Perfusion and permeability imaging can provide information about the intrinsic nature of intraaxial tumors in both the pre- and post-treatment phases. For example, you can see that in this patient who's had surgery previously for an intraaxial tumor, this was an oligodendroglioma, has a new FLAIR hyperintense focus ventral to the cavity. The lesion was very avidly perfused on the CBV map, and this confirmed recurrence of tumor. Surgery and pathology confirmed that this was indeed a recurrent oligodendroglioma. MR spectroscopy can provide detailed information on the chemical composition of parenchymal abnormality. For example, you can see that in this patient with a large necrotic mass, there is reversal of Hunter's angle manifested by increased choline to Na ratio. This is suggestive of a high-grade glioma. MR elastography can provide information on tumor stiffness, such as in this patient with a meningioma centered within the right cavernous sinus. You can see on the elastography map, which is color encoded, that the tumor has moderate stiffness, which may be helpful information to the surgeon prior to resection. CSF flow imaging can be used in a variety of pathologies listed here, such as endoscopic third ventriculostomy, patency, evaluation of cerebral aqueductal stenosis, Arnold-Chiari malformations, normal pressure hydrocephalus, and CSF leak imaging. In this patient here, you can see that there is a jet emanating from the third ventriculostomy tract confirming patency of the ETV. MR angiography can provide detailed analysis of arterial and venous anatomy. MRA can be performed as time of flight technique, which is non-contrast, but it can also be performed with contrast. Vessel wall imaging can complement this analysis, especially in the setting of aneurysms and vasculitis. For example, in this patient who had clinical suspicion for vasculitis, you can see that there is narrowing of the left middle cerebral artery and the right vertebral artery. There is circumferential wall enhancement in panel B within the left middle cerebral artery, in panel C within the right vertebral artery, and in panel D within the posterior cerebral arteries. These findings were highly suspicious for vasculitis. In conclusion, MR provides valuable anatomical detail, and there have been significant advances in MRI in the last few years. It is crucial for the neurosurgeon to be aware of the available imaging tools, not only with regard to requesting specific imaging studies, but also in understanding the value and limitations of specific techniques. We encourage the reader to review the chapter for much more detailed information regarding these and more sequences. I thank you for your attention, and I've included my email below if you have any questions. Thank you.